Outpatient therapy is a powerful tool for millions, offering vital support. But what if it isn't working? For 1 in 10 people, therapy can actually make things worse. Sometimes, facing deep issues without the right support system can feel overwhelming. This isn't a failure of therapy, but a clear sign that a more intensive level of care is required. We'll cover the signs outpatient isn't enough and what higher levels of care actually look like. So, where do we begin? Let's look at the foundational signs your current plan isn't meeting your needs. Sign 1. Your symptoms are getting worse. Despite therapy, your anxiety is higher or depression is deepening. Sign 2. You're struggling with daily life. Basic tasks at work, school, or home now feel impossible to manage. Sign 3. Your self-care is declining. This means major shifts in sleep, appetite, or personal hygiene. Sign 4. You're pulling away from everyone. This is a persistent withdrawal from friends, family, and things you once enjoyed. Finally, there's the therapy plateau. Sessions feel stuck and repetitive. You aren't learning new skills for the challenges you're facing. These signs are clear, but they point to a bigger question. Why does this proven tool sometimes fall short? The main reason is structure. An hour of therapy can be a lifeline, but what about the other 167 hours in a week? And facing difficult memories without daily skills, practice can lead to destabilization instead of healing. Support needs to be consistent. Understanding this gap is key. Now let's discuss the more urgent signs that require immediate attention. Urgent sign 1. Escalating risky behaviors. This includes increased substance use, self-harm, or other impulsive actions. Urgent sign 2. Severe emotional dysregulation. You're having extreme mood swings or outbursts that feel uncontrollable. Urgent sign 3. Changes in your thinking. This could be growing paranoia, confusion, or hearing or seeing things others don't. The most pressing sign is any increase in thoughts of suicide or self-harm. This is an unambiguous signal that the current care isn't enough to maintain safety. This also includes passive thoughts, like wishing you wouldn't wake up. Once-a-week therapy simply cannot provide the monitoring needed when safety is a concern. Recognizing these signs can be frightening, but the good news is there is a clear path forward. So what does higher level of care mean? Remember why therapy can fall short. The gap between sessions. Higher levels of care are designed to fill that exact gap. First, needing more support is not a sign of weakness. It's a sign of self-awareness and commitment to getting the right treatment. Step-up options are often IOP or PHP. Intensive outpatient is a few hours, 3 to 5 days a week. Partial hospitalization is like a job, 6 hours a day, 5 days a week. The goal here is stabilization and skill building in a supportive setting. You get daily treatment without being completely removed from your life. But what happens if the home environment isn't safe, or the crisis is too intense for even these programs? Recall the sign of struggling with daily life? PHP is built for that. It gives you the structure to regain function that weekly therapy can't. This is where residential treatment and inpatient hospitalization are used. Residential offers 24/7 support, while inpatient is for short-term crisis stabilization. Those urgent signs we discussed, like suicidal thoughts or psychosis, are exactly what inpatient hospitalization is for. Its singular purpose is to keep you safe. And that 10% of people who get worse in therapy, it's often because they needed the safety and structure that only a higher level of care could provide from the start. Understanding these options is the first step. So, how can you use this to advocate for yourself or someone you care about? A practical action is using validated screening tools like the PHQ-9 for depression. This gives you objective data to bring to a professional. Bring this information to your therapist or doctor. Start by saying, "I'm concerned my current support isn't enough, and I want to see what other options exist." You do not have to figure this out alone. The goal is to work with professionals who can help you assess the appropriate level of care. Realizing you need more support isn't a setback. It is the bravest step you can take toward getting the care you deserve and finding a path to lasting recovery.